everyone. Yeah, I'm actually just going to talk to you because I'm not going to sort of teach you any science as such. I'm going to really sort of tell you a little bit about me and my route into medicine, in the hope that that might inspire some people. And then I'm going to talk about the importance really of communication, both as a GP and in some of the other work that I do, and hopefully leave you with a few tips and tricks and ideas as to how you can be a good communicator. So to kick us off then, before I get into that, I want to tell you a little bit about my current career as a portfolio GP. Now, it's becoming more and more common that people, particularly in general practice, are having a portfolio of work that they do. So my particular working week, I am actually on maternity leave at the moment, so this isn't quite correct right now, but I will spend some of my week being an NHS GP, seeing patients in clinic, but then I also have other interests. One of my big passions is all around physical activity and how important it is for our health. It's something I've been passionate about for a very long time, and actually, if we go back 10 years or so, there wasn't a great deal of evidence which supported the reasons why physical activity is so important for our health. So although, you know, we all know exercise is good for us, we didn't really have that data. So it wasn't necessarily something that GPs and doctors, nurses, midwives, other healthcare professionals were having conversations with their patients about. Yet it's something that I felt really passionate about. In fact, I think if you were to go back 10 years, a lot of people thought I was a bit mad. I was that GP who was banging on about physical activity all the time. But, you know, things have changed a lot, and it is now really well recognised as something that's incredibly important, and certainly is part of our job as healthcare professionals to be promoting to our patients. So that passion has sort of led me to have 3 leadership roles. I've worked with what was formerly Public Health England. In recent times it's changed, for a number of years now, since 2014. So for 7 years, to develop an education programme for healthcare professionals to make sure that whilst physical activity education was something that was missed from our university education for most of us, there is the opportunity to upskill everybody. So it's called the Clinical Champions Project, and I help Public England instigate that, and there are now loads of clinical champions around the country training healthcare professionals about physical activity. Another role that I have is with the Royal College of GPs, and my role there is kind of similar but slightly different. It's more around changing the social norms of general practice, because if you go into your GP surgery, the chances are you'll see everybody sitting down, not moving, and we know that that's not the right thing for our health. So the RCGP role is around looking at ways in which we can change the social norms in general practice, and GP surgeries, I think, should be beacons of good practice. We should be encouraging staff and patients to be physically active and making sure that they're well linked in with other local community physical activity services and offers. And then I'm also a director of the British Society of Lifestyle Medicine as well. And then the other kind of arm of what I do in my career is working in the media. So yesterday morning, for example, I was on This Morning with Philip and Holly, and we were talking about jingle bells, which is just a kind of smart, I think, slightly funny term that was given to all of the digestive problems that people are more likely to suffer from around Christmas time, indigestion, that type of thing. So I'm one of the resident doctors on This Morning. I've been doing that for a number of years now. I've also worked quite a lot with the BBC. I've made documentaries. I worked on a programme called Trust Me, I'm a Doctor. And then I write a column as well for the Sun newspaper and do quite a lot of work through social media. And the last 6 months, actually, whilst I've been on maternity leave, a lot of my work has been the work that I've been doing through social media. So I do a lot of things. I'm also the co-founder of a charity called Fit for Life, and we work with young people from disadvantaged backgrounds to use physical activity to encourage them. They work with mentors to help them raise their aspirations and do the things they want to do. Anything else? Oh, and I'm also an advisor to a health technology company called Visionable. So I do lots of different things. And it sounds like, how do you do all of that in a week? Well, well, I don't. You know, for example, this morning I might be on there once every 2 weeks, and the RCGP job, I just do 2 half days every month. So there's lots going on, but it's really interesting. And on that note, I think it's an opportunity really for me to just sort of pick up general practice, because it's got a bit of a bad rep lately, because it has been a particularly difficult time for GPs, and I can understand why it would want future doctors or medical students or doctors in training to perhaps not really want to consider GP as top of their list. But there are so many reasons why general practice is a really wonderful career. I think if, like me, you have other interests, which are, everything's linked to medicine in one way or another. So if you have other interests and you want to be able to work as a doctor, but also work in a way that, you know, you can pursue your passions, you pretty much can do that if you're a GP, and, you know, have a positive impact on society whilst you're doing it. So say if maybe you're into photography or cooking and food or travel, there are ways to incorporate those interests and work as a doctor doing those things, and probably get paid for it as well. So general practice gives you that flexibility. Also, you know, I think it's the one specialism where you get to treat the whole patient and get to know them. So we talk about the biopsychosocial model of medicine, and as a GP you really do, you know, consider if somebody comes in with a biological problem, you think about the psychological potential causes and impacts of that problem. I'm going to give an example of that a bit later on. And also, you know, if you have a family later on in life like I have now, you definitely do have more flexibility for like flexible working, and you don't have to, you can if you want to, but you don't have to work weekends, which is a big plus. So lots of great reasons to definitely consider general practice. I didn't think I wanted to be a GP as I went through medical school. And then when I did my F1, F2 years, I actually loved everything that I did, which is probably a bit of a sign that I should be a GP. So I did respiratory medicine, loved that, did plastic surgery, loved that. And it went on. But in my second year of medicine, when I was an F2 doctor, I got this incredible opportunity to be on a TV show called Gladiators and be a gladiator, which is very unusual for a doctor. In fact, I think I'm the only one that ever has done that. Well, I am. So I took a career break for a year, and it was during that career break that I kind of discovered that, you know, that I've spent all my life wanting to be a doctor, and I am now, and that's great and that's amazing, and I always want to do that, but actually there's still a whole wide world out there, and the best way for me to create the other opportunities I wanted to was to go into general practice. So I did, and I've never looked back. So let me get myself back on track. So yes, a little bit about how I got into medicine and how I got into medical school. I knew I wanted to be a doctor from a very young age, from the age of 3. And I managed to get the right GCSEs that I needed to do the correct A-levels. But when it came to doing A-levels, things were quite tricky in my life. There were a lot of things going on. I left home at that time. And well, the results I got were a B, a C, and an E, which no medical school is ever going to let you in with those results. So for me, it was a bit of a dead end. I'd never really come up with anything else that I wanted to do. And so I had 3 years out before I went to uni, and I worked as a landscape gardener. I worked as a holiday rep in Ayia Napa. I sold double glazing. I worked in a supermarket. I also worked in care homes and nursing homes, and worked as an auxiliary, so a care assistant in a hospital setting as well. So after 3 years, I was like, right, it is time to go to university. I definitely do want to go to uni. And the only thing I'm really interested in is the human body and human beings. So went to Newcastle. It was lovely actually to hear Laura's voice there, good old Geordie tones. Went to Newcastle to study biomedical sciences, and actually just scraped in because by that point I was a mature student. And because I'd had 3 years out of education, I struggled at first. The first couple of weeks I found it really, really tough, because learning is a skill, and if you don't practice it, you get a bit rusty. But after a couple of weeks it did click in, and then a few weeks later a lecturer came into the front of the lecture theatre, and I think there were about 300 of us on the combined biomedical sciences courses. And I'll never forget, he said, we are potentially going to allow 6 students in this room to start in year 1 of medical school next year. They said, we're the first university to ever do this. It's the first year we're ever doing it. We don't know if we'll ever do it again. They do still do it. But it's a bit of an experiment, really. And they said, we recognise there are people in this room who want to be doctors, would make fantastic doctors, but for some reason, something's gone wrong along the way. So I, on the one hand, thought, oh, this is my chance, this is my opportunity. And on the other hand, thought, do I really want to be 27 and still at university? I'm glad I did, because it was great, actually. I was sad to leave. So I thought, well, this is my chance. And the application was quite similar to how it still is today, because that pathway still exists. So in the first semester, I had to get at least 70% in all of the 4 modules in order to apply. And the application, it's very similar. I think it's the same now. It's 600 words, why I wanted to be a doctor and how and why I thought I had the right personality and the right skills. And then 300 words of any relevant experience. Now, because I'd worked, not with the intention of getting into medical school, because I genuinely enjoyed working in a care setting. I had plenty to write about there. So I think my tip to people who are, thinking about going to medical school in the future, think about it early. How can you get some sort of genuine work experience, doing something you want to do, ideally getting paid for it. For me, it was a paid job. So did the application. We were told that there would be 12 interviews for the 6 potential places, and 12 interviews there were. But after those interviews, they only offered 2 of us a place. And that place was conditional on, again, getting 70% in every module in the second semester. So it's not an easy way to get into medical school, but that's how I did it. In fact, I was the only one. The other girl who passed the interview, I think she was 2% down on one of her modules or something like that. She did become a doctor later on. She completed that degree and then did the accelerated course. So she is also a doctor. But that was my route into medical school. And I still, whenever I tell that story, I just think, what are the chances of going to university at 21 with terrible A-level results and managing to get into medical school? Is it fate? I think there's a bit of fate. Hard work. I definitely worked my butt off that year in order to win that place. Was it always written in the stars? Was it always meant to be? Was I always going to find a way? I don't know, but that's how I got into medical school. And I think once I got into medical school, often people will say, oh gosh, it must have been so difficult, it must have been so hard, medical school. And it wasn't easy at all, but I funded myself through medical school. So I had 2 jobs. I worked for Red Bull and drove a Red Bull car around, and I also worked in a couple of nightclubs, and I played rugby. I was vice captain of the rugby team one year, and most other years I had a role on the committee. So I was very busy, and I loved all of it. I loved medical school, and I think I, dare I say, found it less difficult than a lot of my counterparts, because I didn't have a privileged upbringing. I went to a secondary school where in year 9, when I couldn't decide what my which courses I wanted to take, my teachers, when I said I want to be a doctor and there's nothing else that interests me, encouraged me to look at other options, because they felt that perhaps wasn't achievable. Because I went to a state school in quite a deprived area. So I always say to people, and there might be people who are on here now who are thinking that they're really passionate, they really want to be doctors, but for whatever reason, perhaps those opportunities won't come up for them. They just might. And, who knows? If you believe it can happen, then it can happen. I always say there are some people in life who have doors swung open for them. They're lucky, they're privileged. And there are other people in life who get doors slammed in their face. But if you get a door slammed in your face, that is not a no. That is, maybe you need to go and have a little walk around the corner and see if there's a window open, and you might just be able to squeeze your way in. So yeah, when it comes to being successful, you've got it. Well, when it comes to being successful, I have a little recipe, and it has 3 ingredients. The first ingredient is hard work. Whoever you are, there is no substitute for hard work. You've got to work hard. The second ingredient is aim beyond your goal. Whatever it is you want to achieve, aim beyond it. So if you want to go to the moon, aim to go to Mars, and you're more likely to get to the moon. If you want to be a millionaire, aim to be a billionaire. You know, if you want to go to medical school, aim to be top of your class in medical school. If you're aiming for that, you're more likely to succeed in the thing that you're aiming for. So 3 ingredients: work hard, aim beyond your goal. And then the third one is self-belief, believe in yourself. We all walk around with a little person on our shoulder saying, no, you can't do it, you're not good enough. And, you know, that person isn't our enemy, but you need to be aware of that person. You need to be aware of that little you that's saying you can't. And whenever they say that, just, you know, be kind to them and just let them know it's okay. Yes, I can. So one of the taglines we have with my charity, Fit for Life, is hashtag yes, I can, because you've got to believe in yourself, and you can. So those are my 3 ingredients for the recipe for success. So I'm going to move on now and talk to you about the topic I'm here to talk to you about, which is communication. Some people are blessed and are naturally good communicators, and some people less so. But communication is a skill that can be taught and can be learned. So we all have the ability to become good communicators. And it's one of the most important, if not the most important, things to make you a good doctor, especially if you're going to be a GP. Sometimes people think that GP isn't a specialty, but of course it is. You do a specialist training program like you would to be a pediatrician or a surgeon or an obstetrician. And I always say that a GP is specialist and knowing a bit about everything. So if you were to take a orthopedic surgeon who specializes in the knee joint, that surgeon knows this much about this much. But as a GP, the skill is knowing this much about this much. And then the other thing that I think GPs are more skilled at, we are masters when it comes to communication. That is our skill. When I was a medical student, in year 3, we did our GP placements, and I went to this lovely practice in Chesterley Street in County Durham. And it was a really interesting practice because I think all of the partners, or all but one, were ex-military. So as someone who was fanatical about physical activity, they kind of were on board with that, which was quite nice. And I remember one of the GPs sitting in with him for an afternoon clinic and him teaching me some various different communication skills. So at that point, I'm going to pause and ask Laura to share with us poll number 1. And I'm going to ask you a little question and see what you think. And you can just put your answers in. Oh, you can just answer the poll. There we go. So the question is, which of the following can be used by the doctor to improve communication in a consultation? Is it silence, repeating back, open questions, body language, or all of the above? And I'm actually going to answer it myself. Well, give you another few seconds to answer that. Okay, now I'm going to go on and tell you about this GP. So he was teaching me something that we call micro skills. So micro skills are different techniques that you can utilize within a consultation. And one example of a micro skill is, looking at your answers. Okay, the majority of you were absolutely right. Well done. It is all of the above. So one of the skills he demonstrated, in fact, in this clinic, he demonstrated a number of the skills that you see there on that list. One was repetition. And I'm probably, you know, changing this story a little bit, partly because I don't remember, and also, you know, we have to keep everything confidential. But it was a little, the consultation went a little bit like this. He said, you know, I'm going to use repetition. I'm going to use it to the extreme to show you just how effective it can be. The patient came in and said, "Doctor, I'm getting terrible headaches." He said, "You're getting terrible headaches?" She said, yeah, I've been getting them for a little while now. They're really bad, you know, they're all around my head. They're quite severe. They're getting me down. They're preventing me from sleeping. He said, "They're getting you down and preventing you from sleeping?" "Yeah, they're really getting me down. I've tried everything. I've tried paracetamol, I've tried ibuprofen, went to the pharmacy assist, they've given me a couple of other things, and nothing seems to be getting rid of them. Or if it does get rid of them, then they keep coming back, and I'm getting quite worried about them. I said, right, okay, so you've tried all those medicines, nothing's really helped, and now you're getting worried. She said, yeah, I'm getting worried about what could be the cause of these headaches. Right, okay, you're worried about the cause. She said, yeah, because I'm under so much stress at work. I'm worried I'm going to lose my job. I'm getting on with my husband. I'm just under so much stress. It's making me feel down. It's making me feel low. And it's giving me these headaches. I said, right, okay. There's lots going on. Stress at work, stress at home. It's giving you headaches. She said, yeah. She said, yeah, I'm really low. She said, last weekend, it got so bad. It got really, really dark. When it got dark, she said, yeah, I got to the point where I wasn't sure I wanted to live anymore. And so you get the gist. This patient's coming with headaches. He has managed to get that patient from a place of coming in with headaches all the way through to starting to talk about this underlying mental health problem of depression, and even to the point where at the weekend before she'd been having thoughts of suicide. And all he'd done was repeat back to her what she said. We always say in a consultation, 90% of it is the history taking. So he demonstrated how just using repetition, he can get the full story from a patient. There are many, many times, I'm sure, when a patient will go in with a headache and leave with some medicine, when actually that patient just needed to be given the time and the space to really uncover what's going on underneath. Patients sometimes come in and it might be that she didn't know that that was causing her headaches till she had the opportunity to talk about it. But often, with something so sensitive as a mental health issue, patients might not feel confident enough to start with that. They might start with the physical symptom, which is linked. And as they come to trust and build rapport with the GP and they feel safe, they might go a bit deeper. So that's just an example of you wouldn't normally use just one micro skill for a whole consultation, but he did something similar with silence, where he didn't say anything. He just used body language. He smiled, he nodded, and the patient came up with the whole story. Eventually, of course, you've got to say something, or else the patient's not going to be very happy. Now, poll number 2. This is a good time to bring in poll number 2. So which of the following is most important when it comes to being a good communicator? Do you think it's speaking very clearly, using body language, smiling and being kind, or actively listening? Which is the most important? Very good. Oh, you're good. Now, of course, they are all important. And I've just been talking about there, if you're using silence for the patient, then using body language is incredibly important. So, body language will be facing your patient, making eye contact, but judging that. Sometimes patients don't want you to make too intense eye contact, smiling when it's appropriate, nodding, all the little that GPs do. Speaking clearly is very important, and smiling and being kind, but actively listening is the most important, because you can perfectly articulate what you want to say to your patient, be lovely and kind, and use great body language. But if you haven't really listened, then that could all be wasted, because the information you're giving them might not be of use to them. And speaking of silence, so although actually using complete silence for a consultation was a bit unusual, but it worked. And interestingly, the patients had no idea these things were going on. To them, it felt very natural. I think personally that using silence when communicating is something that we perhaps could be better at generally as doctors. I think there's this expectation, both from a doctor and often from a patient, that a patient comes in, gives a few clues, and then the doctor does all the talking, asks loads of questions, makes a diagnosis, gives a treatment and a management plan. And that's not always the best way to get the most out of your patient. Actively listening means not just listening to what they've said, but also really understanding what they've said. And sometimes a very carefully placed question or a gentle repetition back to what they've said, or actually using silence, can help your patient deliver more of the story that you're trying to get, and also shows them that you're actively listening. And a really good example of when that is definitely true is in a technique called motivational interviewing, which is a technique, and it was invented by a person called Professor Stephen Rolnick. If you're interested in this, look him up. He's great, and he's got some videos on YouTube as well. And this technique of motivational interviewing was first developed in the context of treating patients with alcohol addiction. And it's a technique to support patients with behaviour change. Changing behaviour is very difficult, particularly in patients who have alcohol addiction and it comes to that alcohol consumption habits. So he developed this technique, and it really does require the doctor to shut up for quite a lot of the consultation, because what we know is that when a person is looking to change a health behaviour, it's only them that is the expert in what the reasons are for that health behaviour, what are the things, the barriers to them making a change, what are the motivators to them making a change, what things can help them be more motivated or be more likely to make a change. And actually, the approach to making that change will be different for everybody. So in the context of physical activity, I could recommend walking football to every man that comes through the door, but it might be only one or two that are interested in that. If you can support a patient to come up with the solutions themselves and understand the things that will hold them back in the future and the things that will help carry them forwards, then they're much more likely to have success. So a lot of the time, I think we need to get out of that zone of thinking that we're the expert and the patient is the receiver of information, and recognise that in a consultation between a patient and a doctor, you're both experts, and you're both just the knowledge that you each have is just as important. And actually, there's probably an argument for saying that the patient's expertise in that particular scenario are more important. So I'll talk a little bit now about the other type of communicating that I do, which is the broadcasting side. And it might surprise you that I, like most people, am absolutely terrified of public speaking. In fact, when I was at medical school, towards the end of medical school, when you start to do problem-based learning, I'm not sure if it's the same now, but on a Friday, you would be expected, often in groups, to go up to the front of the lecture theatre and share your learnings with the rest of the year group. And I would always manage to find a justification or an excuse as to why I either didn't need to go to the front of the room or didn't need to contribute towards that, because I was so terrified of public speaking. And it's something that's really helped me overcome that. Somebody once taught me about reframing, and reframing generally in life is a great thing to do. But in this particular circumstance, they said to me, if you were to ask a BMXer or a skier or a bobsledder or anyone who does an extreme sport how they feel the moment before they compete, they will never say nervous or afraid, even though their heart's pounding, their mouth has gone dry, they might be shaking. They'll say to you that they're excited. And thinking about, you have the choice when you're stood there and you're trembling and you're nervous, you kind of have the choice as to whether you call those symptoms excitement or whether you call it nervous, because actually, it's the same thing that's going on in your body. It's a stress reaction, which you can choose to look at it as a positive or a negative. So that was some really great advice that I got. The time I sort of started to overcome my fear of public speaking, although it's still there, it's less, it was around the time that I kind of did speak out about this passion I have around physical activity and health, and became quite adamant that as healthcare professionals, we should be talking to patients about it. So I started to get invited quite a lot to conferences and to give talks. So it was, for me, I knew I had to get over that fear, because the reason that I wanted to speak to people, the message that I wanted to deliver was too important to let my nerves get in the way. And now, obviously, I'm a broadcaster, so I work on TV and radio, and I also write, and I still get nervous, but it's kind of okay. The first time I ever went on This Morning, I got another piece of really good advice from Emma, who was the producer. So I was absolutely terrified, as you can imagine. I was going to do live TV. There were going to be some viewers calling in with their medical problems, and I was going to be speaking to them to give them some advice. And the advice she gave me is, I'm from Burnley. I grew up in a town called Burnley, and I've got a very northern accent. She said, whatever you do, don't go all la-di-da and try and be posh. She said, there'll be people watching in Burnley. They know what you sound like, and just think how offended they'll be if you've changed the way you speak. So she kind of gave me permission to be myself, because I think sometimes as doctors, we have in our minds an idea as to what we think a doctor is and should be. But to be a good communicator, you have to be yourself and feel comfortable to be yourself, I think. And I think, you know, people will receive that much more better. In fact, I think the people out there who don't necessarily see themselves as the typical doctor, they don't sound like or look like or, you know, have the same personal preferences as what we think of as a typical doctor. I think our profession needs more of you. I think our profession gets richer the more diverse we become as a work group. So and the first time, yeah, to go on to the first time I did do that. So once she said that, and once we've been in the lovely makeup room where the makeup team just make you feel amazing, what I did is I looked at that camera, I looked down the barrel of that camera and imagined the viewer's face whilst listening, and just spoke to her exactly in the same way as I would if she was sat in front of me as a patient, and never looked back. It's been great ever since. So when it comes to public speaking, because as a doctor at some point you're almost definitely gonna do this, and if you get the opportunity to do it, please do it, because public speaking opens so many doors and really helps build your connections and network of whatever your interests are. Please do it. So my 3 tips when it comes to public speaking: number 1, remember that you're excited, you're not nervous, and you should be excited, because whatever it is you're talking about, those people have come to listen, they're interested. So, you know, you're being brave enough to share your knowledge that's inside your brain with them, and they don't know what you're going to say. So you shouldn't be nervous, you should be excited. Second one is show your personality, tell them a little bit about you, a little short anecdote. You'll notice when people do TED Talks, the structure of that is they always share something, mostly anyway, they always share something personal first and let you know a little bit about them. What that does is, you know, it draws people in, it shows them that you're a person. And even if there are experts in the room that know more about the topic than you, they don't know more about you than you. So you are the best expert when it comes to you. So share a bit of something about yourself. And tip number 3 is, I've been using it quite a lot, the rule of 3s. Whenever you're public speaking, people love to be given information in 3s. So I've done it a few times, I'm doing it right now. There's something about when people say, I'm going to give you 2 tips, we feel a bit shortchanged. And if we give you 4, then it's a bit too much to get your head around and remember. So whatever your take-home message ever is from a talk in public speaking, deliver it as the rule of 3, and people love it. And I'm just looking up the time there. We're sort of coming up to towards 40 minutes. So let's break for a moment and see if you guys have any questions, anything you want to ask at all about communication, about how I got into medical school, or in fact anything, physical activity, anything at all that you want to ask, please do go ahead.
You've got a lot of questions.
Oh, good.
There's loads and loads of questions. So shall I just start firing away?
Yeah, go for it.
Perfect. And so what for you, actually we're starting on potentially a negative thing, but what for you is the most difficult thing that a GP could face?
Ooh, what is the most difficult thing that a GP could face? I think the most difficult thing that any doctor can face is making a mistake and somebody having a poor negative outcome because of it. And, you know, the chances are that at some point in your life, you are going to make a mistake, because we're human beings and we're not machines. And sometimes we get it wrong or we miss things. You know, when it comes to life and death matters, usually there are other things in place so that, you know, even if you make a mistake, it gets picked up. But we do make mistakes, and sometimes there can be negative consequences. It may result in a complaint. My advice around that is, you know, make sure it comes back to communication. If you make a mistake, the minute you realize you've made a mistake, don't try and cover it up. Speak to somebody, speak to if you're a medical student or a junior doctor, speak to a senior member of staff. If you're a senior doctor, if you're a GP like me or a consultant, you speak to a colleague, and whoever that person is, the patient or their relatives, you inform them. We know that the vast majority actually of complaints come about not when doctors make mistakes, but when there's poor communication, either about the mistake or poor communication anyway. So, we will make mistakes, but make sure your communication is on top form when you do make them.
Excellent, thank you. And how do you cope with often being in the media whilst also being a successful GP?
How do I cope with it? For me, I'm the type of person who kind of enjoys a little bit of chaos. So no 2 weeks for me are the same. I don't have great structure. I don't have great routine in life generally, which is not great for a lot of people. But for me, I kind of thrive on it. If I go back to when I was working as a full-time GP in the first, well, actually, even from when I first started as a fully qualified GP, I had already started these other interests, but I was working mostly as a full-time GP. I wasn't as good at my job because I was doing so much of it. The more diverse my working week is, the more I enjoy each bit of it. So I quite enjoy the juggle. But like I say, it's not necessarily good for everybody. I go to bed and get up at a different time every day. And, some people like to have that structure and routine and thrive off it. And some people are a bit like me, all over the place.
I like structure, that stresses me out thinking about getting up every times. And what is your favourite and least favourite part of being a GP?
Okay, my favourite part of being a GP is, I've always been fascinated by medicine and the science, but also I've always just been fascinated by human beings, by people. I just find it so fascinating, and it's such a privilege to have a little looking glass into people's lives and people's worlds. I think, as I mentioned, I didn't have a privileged upbringing. We were once a single parent family, and, we relied on benefits. But we were never really, really poor. We always had enough food to eat. So I've gone from being very much working class to becoming a doctor, which apparently makes me middle class. But now working in a community where there is a lot of poverty. I think there are very few people who are lucky enough to experience all three. And I really wish actually that the politicians leading this country could experience all three, because we'd be living in a much better world. Did that answer the question actually? So the best thing is seeing into people's, just really getting that experience of people. They share more with their GP than they do with their partner often. They tell you everything, which is really interesting. And the least favourite bit of it is, I think it is stressful, and it can be very, some of what we see is not very pleasant. So there aren't many professions in life. There are a few, police, I think, see it as well, maybe ambulance drivers, where you see some of the dark stuff that most of us are protected from. So when you get quite heavily involved and take on a lot of information about things like cases of child abuse or domestic violence, it's not nice.
Do you have any kind of anything in place that helps you when you see something negative like that? Any tools that you go
to? In my own personal experience, I think medical school really prepared me quite well. And it's not that you become numb to it, but you do, again, it's all learning a skill. Like, you can learn any skill. The more you practice it, the better you get at it. And when you work as a GP and you do experience, things that are unpleasant, I think you are able to, on a Friday, walk out the door and almost not forget about it, but compartmentalize it in a part of your brain that it doesn't impact on your life at home, and then pick it up again if you need to on Monday. So I think that's very much a skill that you learn. There's something else at medical school that you learn, and it's to find humour in things that aren't funny at all, things that are very sad, things that are awful. You learn to find a form of humour in them. And I remember when we used to do MedSoc on a Friday, and some of the lecturers would actually almost teach you that skill. And it's something that is kind of only talked about within medical circles. It's not something you go home and have these sort of humour conversations with your relatives, but it's something that I think helps you deal with the trauma. Not that you think it's funny and it's not inappropriate, but it's a way of keeping yourself sane.
Thanks. And what do you think
has been the greatest impact for GPs during COVID-19?
Say that again, sorry.
What do you think has been the
Greatest impact for GPs during COVID? So how's it impacted GPs?
It's been different at different times, hasn't it? I think there was a time when people were banging their pans for NHS staff, and now we are currently in a phase where there's sadly a lot of anger being diverted towards GPs because patients aren't able to get the appointments or the types of appointments that they want. And there's such a lot of pressure on GPs. And my advice to anyone out there is, I in the last 6 months have been more of a service user than a service provider myself, and I understand those frustrations, and I don't think people are wrong to be upset and angry, but they are wrong to be taking it out on GPs, because it's not GP's fault. I think 90% of consultations go on in general practice, but general practice only gets 9% of the NHS budget. So there needs to be change, and that anger should be directed to people much higher up to ensure that general practice is funded correctly. And essentially we just need more GPs.
And how do you balance being a
GP with doing all the other things that interest you?
It is a juggle. It really is a juggle. And I think a lot of the things that I do have quite a bit of flexibility when it comes to diary. So I have my 2 GP days and they're set in stone. So, anybody that I'm working with in the other realms that I spoke about kind of knows that those days are not available. I'm a salaried GP, so I work at the same practice, although we have 3 different sites. So I can be at 3 different sites. And then, with everything else, I do have an agent who's really helpful with managing my diary. But it's just about diary management as best I can. And I have days that are very, very busy, and then days that are less busy. And I think it boils back down to me being the type of person that is able to manage that. One day I might have to get up at 5 o'clock in the morning and not get home till midnight. The next day I might be able to have a lie until 10 a.m. And that works okay for me.
Excellent, thank you. And there's a question asking if
you think that there's any kind of gender inequality issue within general practice.
I think there's a gender inequality issue in the world, full stop, in every profession. And medicine's not excluded from that, and even general practice isn't excluded from that. It's not necessarily anyone's fault, but as women, we spend 10 years of our life being on our period. Then we're faced with menopause at the other end, and in between, if we choose to have children, then that can affect our career as well. So there are reasons outside of any employer's control that there are gender differences, and I do think that we're moving in the right direction. I think there need to be allowances made in the workspace generally. Now, I think in general practice, which is predominantly dominated by women, there are more women in men than every practice that I've ever worked in. I don't necessarily feel like you're treated any differently whether you're a male doctor or a female doctor. In fact, in some instances, a lot of patients will prefer to see a female doctor, and that's rightly so, particularly if it's a gynae issue. But I wonder sometimes, does that make the men feel a bit pushed to one side? I don't know. So I think, gender inequality, race inequality, sexuality inequality, disability inequality. I think we're a long way from eliminating any of those inequalities. And I feel like the past 12 months, there have been some baby steps forwards when it comes to women's health, for example, and it also comes to race disparities. But we're a long, long way off eliminating inequalities. It's another big passion, and one of the inequalities that is not spoken about enough is the socioeconomic inequality. We often talk about race and sexuality and disability and various others, but we very rarely talk about how people living in poverty are hugely underrepresented. So yeah, that's another one to think about. It's a huge thing for us to, it's a huge issue that needs looking at, is the health inequalities when it comes to poverty. So where I work in the borough of Southwark in London, there's a bus that runs from one end of the borough to the other. And if you live at one end, you can expect to live 9 years longer than if you live at the other end. And, that's set in stone from the day you're born. Your postcode determines how long you're likely to live on average. And the children living in the poorer area are twice as likely to develop obesity than those living in the most affluent area. And that's not develop obesity as adults, that's develop obesity in childhood. So we really, it's one of the biggest issues I think this country faces, is the health inequalities linked to poverty.
Thank you. That's a really scary stat, isn't it? Definitely. And someone is asking, actually, if you weren't a GP, what do you think your speciality would have ended up being?
I'd probably be a dermatologist, and that's because I did. My second ever job as a doctor was plastic surgery, and I loved it. I loved it so much, especially the skin surgery element to it. But I spoke to my seniors, my registrars, and they sort of explained to me what was involved to progress through a career in plastic surgery, and it wasn't going to fit with my life plans for the rest of my life. So it kind of was like, So then when I did a dermatology job in F2, and there was still skin surgery that could be done. And actually, as an F2, we were given our own little clinic. So we did skin surgery, and I just loved it. But also that meant you could still continue with your medicine and do inpatient stuff, but also very rarely, once you reach consultant, would you have to go in on a weekend, which wasn't something I wanted to do. So yeah, I was going to be a dermatologist until I became a gladiator, and thought there are things outside of medicine that I also want to do. And actually being a GP gives me that flexibility.
Just a question from me. How did
the gladiator thing come about?
So Gladiators, when it was like the massive big show in the 90s, I was a teenager then and loved it. Saturday nights were Baywatch, Gladiators, Blind Date. So when it came back in 2008 on Sky, I again was glued to the TV screen thinking, this is amazing. And at the end of the first series, a friend of mine, Shawsey, Joe Shaw, who used to play for Newcastle Falcons rugby, he rang me up and he said, you should apply to be a contestant in the next series. And I was like, I can't do that. I'm a doctor now, and it's my dream to become a doctor. And what will people say? What will people think? And he reminded me how much my student loan was, and that there was quite a hefty prize fund if I won it. He said, which you probably will. So I applied to be a contestant, and went along to the audition day. And at the end of that day, they asked me to come back the following week to audition to be one of the new gladiators that they were casting for the next series. So I went to that audition thinking, don't stand a chance, turned up, and there were all these GB athletes there. I just thought, I'm just going to enjoy myself, have a great day. And because I'd been playing rugby through uni, I'd never touched a rugby ball before I got to university. I really just did have all the right attributes. I was strong, I was sort of brave, didn't mind a bit of rough and tumble, was powerful. So on that day, I just gave it my all and made it through to the very end of the day. There were 6 of us at the end, and we had to do a drama workshop. I'm like, well, this is where my weakness is going to be, but managed to get through that as well. And then had a 3-week wait to find out if I'd been successful. And I remember I was doing dermatology at the time. I was on the ward, and I dipped into the toilet to take the phone call, and they said, yeah, we'd like you to come to London and wear lycra for the next 3 months. that was that.
It's just such an eclectic mix of a career. It's fantastic and really good for people to hear as well. That's great.
A lot of people were very supportive. In fact, when you're an F1 doctor, you have a consultant who's like your go-to person if you're having any issues. And then there was a lovely lady called Nicole who looked after us as well. So, when I had to hand in my notice to be able to go and do it, but I wasn't allowed to tell anybody why. I was sworn to secrecy, and actually Sky, the channel, had said, if this news is broken other than by us, you're out. So I just handed in my notice. So I was called into a meeting, and they were really concerned. They're like, it seems like you've been doing fine. What's happening? So in confidence, I was able to tell them the reason why. And they were incredibly supportive. There were some other doctors and consultants who sort of said, you're making a big mistake here. And, people won't take you seriously. What is this? It was a very small number, and they were absolutely wrong, because it helped me grow and develop as a person. It helped me, open my mind to the bigger world out there. And made me believe that anything is possible. And, now I have a career as a doctor in TV, which is just, I still pinch myself. But, without the Gladiators experience, maybe I wouldn't have had the belief that that was possible.
That's great, thank you. Right, getting back to other people's questions
now. Do GPs ever perform surgical procedures?
Yes, absolutely. So often a practice, if it's quite a large practice, will have one or two doctors that specialise in minor surgery. So that's, usually minor skin things. But also, we now see as a GP, if you want to subspecialise in something which might see you doing slightly more complex surgery than the basic, sort of cyst removals and what have you, then absolutely you can. We also have a lot of doctors who have come into general practice later, having already trained to be a specialist in something else. So they're dual qualified, and might be doing some surgery clinics alongside doing general practice, sometimes maybe doing it privately alongside their NHS GP work. So people are really passionate about surgery, skin surgery. You could still do it, and I could still do it, but I've kind of gone down the lifestyle medicine route now, the physical activity route, and I've got quite a lot on.
Yeah, definitely. And what makes someone a
well-rounded doctor in terms of skills, habits, and mindset?
Skills, habits, and mindset. What makes someone a good doctor? I mean, the number one thing that makes someone a good doctor is if you care, which I think it's a bit of a cliche, isn't it, that everyone in that medical school interview, they say, why do you want to be a doctor? And everyone says, because I want to help people, because I care, which they come back straight out with, by the way, with why don't you be a nurse then? And I think, a lot of people go into medicine because they care and want to help people, but a lot of people go into medicine because they're smart, they're bright, and really they've gone through school, they've gone through A-levels, and they've kind of always had two options, law or medicine, and maybe they don't have that in their nature. That doesn't mean you absolutely can't be a doctor, but it means you probably need to work harder in some areas, or there might be certain specialties within medicine that are more suited to you. But if you're going to be a GP, if you genuinely care, that's going to see you probably doing the right thing and making the right decision, and having the motivation to get up and go what is, quite a hard day's work. So what are the right skills? Communication skills, definitely the most important skill if you're going to be a doctor that's patient facing. Attributes, I think just being kind, but also being thorough. And what else was there? It was skills,
mindset,
and habits. Now, when it comes to habits, there's this old saying, isn't there, of practice what you preach. And I do to some extent. I'm fully vaccinated, and I've exercised regularly, and I try to eat quite healthily. I probably drink more alcohol than I should. But what we find, particularly in lifestyle medicine, is that doctors who are physically active themselves are much more likely to talk about physical activity and be able to inspire their patients. Doctors who are really interested in diet and nutrition and are striving to eat really healthily themselves and will like to have those conversations as well. So if you have healthy habits yourself, not only will it obviously help you, but it's likely to have a knock-on effect of helping your patients. That's not to say that we all need to be perfect, and I'm certainly not. And, you know, like I say, probably I'm guilty of the occasional binge drinking session, and, you know, I'm not perfect. But yeah, having healthy habits and trying to develop them from as young an age as possible is a really good thing and will make you a better doctor.
Excellent, thank you. And I've just seen the time.
So as a final question, have you got any kind of final advice or final thoughts for anyone who's wanting to go into medicine?
I think, you know, it comes back to those 3 ingredients, the recipe for success, which is you're going to have to work hard, so get your head down. The second one is aim for whatever is beyond your goal will help you get to your goal, and self-belief. Remember, keep saying, yes, I can, yes, I can. I think the final thing I just want to say is to anyone who's on this Zoom call who thinks that they do want to go to medical school, good luck, and just keep fighting until you get there. If you don't get there at the age of 18, I went to medical school at 21. There were people, and I wasn't, by no means was I the youngest. Just keep fighting for it. And if you get doors slammed in your face, have a little look around the corner. There might be a window open that you can just prize yourself into. And then finally, you know, if you don't think you're the stereotypical doctor, do not let that put you off. Just go for it.
Excellent, thank you. It's been such a pleasure to talk to you
and ask you loads of questions. It's really, really lovely to end the mini medical school on such an inspiring talk with someone so kind of relatable. So thank you very much. It's been a pleasure. Enjoy the rest of your evening.
Thanks for having me. And yeah, good luck, everyone.
Thank you. Bye.
Bye.